Okay, well, let's get started. Thank you all for joining us. Oh, flurries in Michigan. We'll have a full weather report for you in the chat box, so feel free to check in there. I'm just gonna share my screen. We have a few slides to kick us off. And I think you all can see that, but Myla, definitely let me know if you can't, if there's any issues. So welcome everyone. We're so glad to have you here with us for our webinar today, which is an Ask Me Anything on Academic Health Department partnerships. So thank you for joining us. We're really looking forward to engaging in this discussion. This is actually the second Ask Me Anything webinar that we've done focused on academic health department partnerships, and the last one was really exciting. It was like a flurry of activity of questions flying everywhere in the chat box, out loud, all over the place. So we're really looking forward to doing this again, and wanted to make the space available to hear what questions you have, and for all of us, everyone, to share any advice. So just to get us started, you can see probably as you came in that we're a pretty informal group, but we do have a few housekeeping items that we just wanted to mention. So first of all, audio is available either through your computer speakers or over the phone, whichever you prefer. Whichever you choose, we just ask that you please keep yourself on mute when you're not speaking to help reduce any of that background noise that can happen during webinars. We will have lots of time for discussion and questions, and as I mentioned, we hope you will jump right into that with us. Feel free to have your video on throughout the webinar if you'd like to. You can put questions or comments in the chat at any time. And when we sort of break, we have a handful of slides at the beginning here, just a little bit of background overview material, and then we will open the floor for questions. So feel free to raise your hand and ask your questions out loud. If you have any technical difficulties with anything today, just send us a message in the chat as well, and we can help you troubleshoot that. Myla, I saw just put the link to the slides for the webinar are in the chat box, so you can get that there if you'd like a copy of those. And just an FYI, we are recording the webinar, and the archive should be available later this week. So we'll start with a few introductions. My name is Kathleen Amos. It's great to see you all today. I'm the Director of Workforce Development at the Public Health Foundation. And as part of this role, I work really closely with the Council on Linkages between academia and public health practice on its initiatives, including our Academic Health Department Learning Community. I've been doing this work for just over a dozen years now. And it's been really fun to watch this grow over the years. I'm joined today by the chair of the Council on Linkages and of the Academic Health Department Learning Community, Dr. Bill Keck, who I will ask to introduce himself as well.
Well, Kathleen, you've already introduced me fairly well. I am Bill Keck. I'm a Professor Emeritus of Family and Community Medicine at the Northeast Ohio Medical University, and as Kathleen mentioned, chair of the Council on Linkages and the Learning Community. And as it is with Kathleen, I'm looking forward to chatting with you all today.
Thank you, Bill. We're also joined by two other members of our Public Health Foundation team here. Myla Arana, who's our Senior Program Manager in Workforce Development, who you will see in the chat box and when we get to the Q&A portion of the event. And Ron Bialik, our President and CEO, who will be hanging out in the chat box throughout. So if you want to stump him with questions, feel free to put them in there. I'd also like to just take a minute to introduce the Council on Linkages between academia and public health practice for anyone who's not really familiar with that group. The Council on Linkages is a consensus-driven collaborative of 24 national organizations, both public health practice and academic organizations, engaged in efforts to improve the education, training, research, and practice of public health. So as you can see on the slide here, the members of the Council on Linkages span a variety of professional groups in public health, as well as several federal agencies, the accrediting bodies, both for health departments and academic public health, and the certifying body for public health professionals. We at the Public Health Foundation serve as the convener of the Council on Linkages, and we provide the staff support that helps keep everything running. So I also just wanted to introduce our agenda. It's not really a strong agenda, but kind of our overview of the session for today. One longstanding initiative of the Council on Linkages is to provide support for academic health department partnerships, or AHD partnerships. And obviously that's what we're here to talk about today. So we'll start with a little bit of a brief introduction to academic health department partnerships and to the Council on Linkages Academic Health Department Learning Community. And then we will open the floor to you and your questions. So as mentioned, we had a really lively discussion the last time. So we're very much looking forward to do that again today. We'll do our best to answer whatever questions you send our way. And we really, really welcome your expertise as well. So please chime in at any point if you have thoughts on someone's question, if you have experiences to share, advice, anything that you think might be useful, we'd be happy to hear it. We'll all learn together. So before we dive into that, we'd also love to learn a little bit about you. And we do have a quick poll here, which Mayala will launch. Yep. So we're curious about the type of organization you are joining us from. So we invite you to share in the poll. And if you have any difficulty, feel free to put your answer in the chat, or if your answer is other, feel free to share more about that in the chat as well. So we'll give everyone a few seconds to do this. Awesome. Local health department is currently winning 42% of the vote. All right. Awesome. So I think we should be about good. Myla, can you share that so everyone can see the results?
Yes, these are the results.
Oh, perfect. Excellent. I'm the one behind the game. So yeah, so we did end up with the largest contingent being from local health departments, followed by state health departments and academic institutions. So that's awesome. Mm-hmm. Excellent. Oops. Cool. So back to the slides. We wanted to start off here with just an overview of what an AHD partnership is and how that might be useful. So to get all of this started, we wanted to begin with a definition of academic health department partnership. So that's it's kind of a loose definition. There's not really a strong, sort of, you must do X, Y, and Z to be able to call yourself an academic health department, but we do have some characteristics that we tend to think about. So we are talking, as it sounds from the name, we're talking about partnerships that have been built between health departments and academic institutions. And these can take a variety of forms, but at their core, they're collaborative, mutually beneficial relationships that serve to strengthen and formalize collaboration. So we're really looking at moving relationship between the organizations beyond working together kind of sporadically because two people happen to like each other, to a more regular part of how the organizations operate. These partnerships serve to strengthen connections between public health practice and academia, and as I mentioned earlier, enhance the capacity of the organizations involved, as well as further the pipeline into governmental public health. AHD partnerships can look quite different, as I'm sure you'll see illustrated throughout the session today. They really can look quite different from one community to the next. There's no one right way to do it, to develop a partnership. But with that said, there are, as I mentioned, some basic characteristics that the Council on Linkages typically talks about as being part of an academic health department partnership. So at the most basic level, an AHD partnership has at least one academic institution and one health department working together. As part of that working together, there may be some type of written agreement linking the organizations. So a contract, a memorandum of agreement, a memorandum of understanding, something like that. And then through the partnership, the organizations may engage collaboratively in providing education and training to both to students and the current workforce, work together on joint research projects, or jointly provide public health services. And these partnerships may also involve, I think someone put in the chat that they're in a joint position. So these partnerships often also involve the sharing of personnel, funding, or other resources between the organizations. So we do have one other quick poll here because we'd love to get a sense of your experience with AHD partnerships. So if you would like to share whether your organization participates in any partnerships, we can do that now, and Myla will pull up the poll for us. And again, if that's not working for any reason, feel free to share your answer just in the chat. There we go. I see Ron's already answering questions for you all. Okay, we'll give you just a few more seconds there. Okay. So luckily, almost everyone is interested in AHD partnerships at the very least. It'll be very boring if you're not remotely interested in this probably for the next little while. But yeah, it's great to see about 70% have at least one AHD partnership and another 25% are working on it. So that's fantastic. And hopefully there will be something here today that will help you take it the next step.
Yes, right. Yeah, right. I know. I didn't take it today. No, I was on it a couple days.
Awesome. So in addition to the results we just demonstrated, we also know that collaboration and partnerships between academic and practice organizations are widespread. And we know this because both the National Association of County and City Health Officials and the Association of State and Territorial Health Officials collect data on partnerships through their profile studies. These data show that the majority of local and state health departments work with academic institutions in some way. So about 88% of local health departments report working with colleges or universities, with 62% having regular meetings, written agreements, or sharing personnel or resources. So some of those things that we just mentioned tend to be associated with having a more formal partnership. Similarly, 100% of state health departments report working on projects with academic institutions. So AHD partnerships, you know, it does require some work to do this, as I'm sure you all know. And there are a lot of benefits, I think, that we've heard come out of these partnerships. So like, what does it, you know, this is what makes it worth it, I guess, to put in that time and that effort. So these partnerships really do strengthen connections between different areas within public health. There are lots of reasons that organizations engage in these partnerships. What we've highlighted on the slide here are some of the ones that we hear more commonly working with organizations across the country. So AHD partnerships may help the organizations enhance their capacity and better address community health needs. Many of these partnerships involve student training through things like internships and practicums, or health department staff providing guest lectures at the university, things like that. And these experiences can really help provide students with more practice-based content, practice experiences, that kind of perspective, which in turn helps better prepare them for jobs in health departments when they graduate. These partnerships can help with the recruitment of qualified personnel, particularly again in terms of that pathway from academia into governmental public health, facilitate lifelong learning for both practitioners and faculty, develop and use research that is relevant to practice, because these partnerships often bring academic researchers closer to public health practice. They tend to emphasize more community-based research activities, maximize the use of resources, and enhance competitiveness for new resources, help in meeting accreditation standards, both for health departments as well as academic institutions. And ultimately, these are all part of a larger picture, and we hope all of them help serve to strengthen the public health system and improve the public's health. So we wanted to say just a few words about the Academic Health Department Learning Community before we open up to questions, although I can see there's questions happening in the chat box, so definitely keep those coming. So I mentioned that the Council on Linkages has hosts an Academic Health Department Learning Community, and this initiative aims to help support organizations working to develop and sustain AHD partnerships. So providing an opportunity for people to explore the idea together, to learn from each other through events like what we're doing right now. The learning community has been around since 2011. It is open to anyone who is interested in participating, and we currently have more than 1,500 members from health departments, academic institutions, and other types of organizations across the country. The learning community offers a way for people to connect with others who are engaged in this work, as well as we have tools, resources, training, and technical assistance to organizations who are working to establish and grow AHD partnerships. So the activities that the learning community engages in include things like sharing stories and highlighting AHD partnerships, webinars. We often have webinars that feature successful AHD partnerships to share those examples. Developing resources, such as we have a collection of agreements, partnership agreements that organizations have used to formalize their partnerships. And enabling dialogue and assistance. So all of the resources that are available through the learning community are freely available to anyone who would like to use them. And that is that. That's our brief introduction today. We're going to stop here because we'd really like to spend the rest of our time together hearing from you, what your questions are. And we'd love to talk about whatever it is you would like to talk about. So feel free to continue to put questions in the chat. And also feel free to raise your hand if you would like to speak, and you can unmute yourself. So I will turn things over to Myella to tell us what questions we should answer first.
Great. Thanks so much, Kathleen, for setting the context for our conversation. Really appreciate it. Let's maybe start with what do you think you've learned is the best way to start the conversation on a partnership or a project?
Shall I start, Kathleen? And
go for it.
You can all fill in then. Generally, these things start when people have issues they're facing, things they want to do that they can't really do alone, but could do better with a partner. So from the academic institutions, as many of you know, one of the first common issues is, where do I get practicum sites for my public health students? And that means talking to local practitioners, health departments primarily, but other sites as well. And for the health department, it might be something like that, or it might be you're facing an issue in your community that you need help with, or you're in a bit of a crisis like the COVID epidemic or pandemic that we've recently all been through. Many health departments turn to their university partners for help with that, professional help doing the epidemiology, student help and faculty help with contact tracing and so on. So it really depends on what's going on in your own environment and what might be an opportunity for you to involve some others in helping you deal with whatever the issue may be.
That's a really good perspective, and I think you mentioned two things that I know we had a comment in advance about, like, what are some common things, the common activities that happen through AHD partnerships, and that discussion around having student internships or practicum placements or things like that. It tends to be, I think, a conversation that often gets some of this stuff going, because there are just so many opportunities in that area, both in terms of schools and programs wanting to provide that practice experience for their students, and health departments in terms of having sort of some extra opportunities to get things done, things like that. And the other one you mentioned, COVID, I think we, particularly with COVID, we've seen a huge, I don't, wave is not really the right word, but I'm sort of blanking on the right word, but a ton of AHD partnerships that have relied on students and faculty to really provide that extra support for health departments in terms of, you know, everything from developing communications materials to staffing vaccination clinics, all of the stuff. So those tend to be really popular. Does anyone else have any suggestions or ideas about how you can ways to get that conversation started between the organizations? All right, then. Carry on. Feel free to put them in the chat if you think of something.
Absolutely.
Great, thank you. Katie, I see you have your hand up if you wanted to go ahead and jump in.
Yeah, sorry, I'm like also typing in the chat. So I the academic health department coordinator basically at University of Arizona. And I guess I know some people were asking about kind of structure, and I think that our structure is a little bit atypical of the academic health departments. I'm relatively new in the position, but I think that in general, our academic health departments, particularly with Pima County, where the university is located, have a bit of a history, maybe more than some other academic health departments. But I know that I also asked a question in the chat about, you know, like, what's the equivalent of an academic, or what's the equivalent of a teaching hospital? And so, like, I think it would be nice, I don't know if it's here or later, but to talk about kind of some of the challenges and barriers. So I know, like, historically, it's my understanding that the county actually approached us saying they wanted to have an academic health department. However, we now have 4 MOUs with 4 different counties, and my position is half-time, and there doesn't seem to be kind of a budget attached to to doing anything with the academic health department. And I think another challenge that we have is that, like, I mean, I have been with the University of Arizona for a long time, since the 90s off and on. And we've always been working collaboratively. I also worked with the local health department and state health department. And so we've always been working collaboratively, and there's a lot going on, but to kind of wrangle that within, I know somebody asked about state health department. It's the same kind of thing with us on our end. And we've had that interaction with ADHS as well, where it's like there's all these partnering going on, but we're not fully aware of it. And so I think the idea is to kind of streamline it, but it's the same thing with ADHS, where they're like, some people are reaching out and are not aware of, like, what other people are doing. So I think that's one of the challenges that I think as a community we can kind of discuss, like, how to address. And the other thing I wanted to just add is, I know that we have also really emphasized in our thinking, at least, I don't know in terms of operationalizing it, but in our thinking, you know, we also have a faculty that doesn't necessarily have experience in government health departments and local health departments or in state health departments. And so there's this kind of disconnect even when we do have interns in the government health departments, like they may not have received the training that they need because our faculty themselves are not aware. So that training really needs to be cross-training back and, you know, forth. It's a two-way kind of training.
Yes, well,
Thank you.
these really are two very different cultures that we're trying to meld together and to create a collaborative partnership with. And so it makes sense to think about the cultural differences between the two and to try to help overcome them. But we've certainly found that it helps a great deal to have a champion in each setting, at least one person, preferably somebody who can make decisions and have things happen, but it doesn't have to be that if their boss is willing to support them. But a champion on each side can often help smooth out those bumps in the road that come when people who are working under very different constraints and objectives actually try to find a way to come together to solve a particular problem or deal with a particular issue. But yes, it's not everybody's a good collaborator, you know, and it's worthwhile asking yourself whether you are a good collaborator and focusing on what some of the skills and attributes of good collaboration are before you get involved. And certainly, if you find a champion or champions in the other setting, you'll want to try to find someone who is capable of collaborating with someone from a very different kind of workplace.
Yeah, and I think you mentioned, like in terms of challenges, you mentioned several of the bigger ones that we hear. Funding comes up all the time. How do you fund this work? And I think people, you know, oftentimes there's not funding that's specifically dedicated to the AHD partnership itself, but more is funding for activities that the partnership helps you accomplish, if that makes sense. So I know of only like one or two groups, and not that there may be thousands others that I don't know about, but of all the groups that I've talked with, only one or two have gotten funding specifically to build a partnership, to build an AHD partnership. And the rest of them, it's been more like, well, we have this grant to do this work, and it would be really helpful if we could work together with the health department, or as someone mentioned in the chat, through the public health infrastructure grant program that's happening right now, there are several health departments that are using some of that funding to help pay for a person, staff member who would focus on AHD partnership work. So that's another area where you can kind of like tap into resources that maybe weren't specifically for that thing, but are broader. In terms of, I think some places people have been more successful is with like state-based associations, foundations, things like that. More so than national. There really isn't good national funding, I would say, devoted to academic health department work. Ron just put in the chat the Massachusetts Department of Public Health. They, I believe, have used their public health infrastructure grant funding to hire an AHD manager, coordinator, and they've made a lot of investments in that work in a number of ways. And one of the things they've also been able to do, and I don't know if there's anyone from Massachusetts here who wants to say anything about it, but they've been able to set up like a trust fund for their AHD work, so that to help kind of deal with some of that question of sustainability over time. So yeah, I think there's lots of innovative things, but it has its challenges. And the other challenge I think that comes up a lot is just like knowing who to talk to, right? Like we've got two potentially big faceless kind of organizations, and how do you know who to talk to if you want to work together? And so what you all have done in Arizona, I've actually worked with your group in Arizona since right from the very beginning of developing their partnership. So it's been really fun to watch that develop over the years. But one of the things that I remember having conversations about was that having that designated point person. So like, and I'll add to Bill's having a champion, having leadership support, having a point person who's responsible for the partnership, whether it's a shared position or someone in each organization, to really make that connection, to be the person that you can call when you want to do work on something together, I think has been hugely helpful, because it just, you know, puts a face to a name and you know who to contact, and then they can help you navigate the organization.
Kathleen, it might be worth saying here that particularly for medium-sized to larger health departments, that if you concentrate on just finding new funding to do this, it may be a real barrier. And certainly in my case and in many others, we're able to take an existing vacancy and split it, and do the same with your partners, so that each partner pays part of a salary of two different people. So you still have the same number of people paid for out of the same budget, but now they're added, or part of their initial responsibility is to feed the collaboration, is the care and feeding of it, and to focus on whatever tasks the collaboration is aimed at. So it is certainly possible within existing budgets of reasonably sized health departments and most academic institutions to make that kind of choice. It just means making the choice.
Yeah, I've heard of a lot of piecing it together from various grants, little bits here and there, to like come up with something.
Better if you can do it from your core budget, because
Yeah.
then about the timeliness of the grant and how long you're going to have it. Mm-hmm.
And I don't know, Bill or Ron, if either of you have thoughts about, Katie, you mentioned faculty potentially not having practice experience. And I think that AHD partnerships have really, that is another good strength of those kind, because it provides a way to kind of bring that practice perspective into the educational environment. But Ron and Bill, you all have both taught in those environments, so I have not. So I don't know if there's anything that you wanted to mention about that, or that you thought about.
Well, no, there are some faculty that never want anywhere near a local health department, quite frankly, and there are some practitioners I wouldn't want anywhere near my faculty. But yes, for those who have an interest in research or teaching, then this experience is something worthwhile for them. Absolutely.
Yeah, Kathleen, I was wondering, maybe I'll put her on the spot. Sarah can chime in because she is a academic manager. I can't remember exactly your title in Toledo, Lucas County, but you know, you're somebody experiencing this with a local health department.
Yeah. So sorry for coming in late, but I'm glad to be here. Thank you, Ron. So I am the academic public health manager here at the Toledo Lucas County Health Department. We are a county city merged health department. So my sole focus is on building our health department up to be a academic health department. So right now, I'm the only person doing this, but my position is grant funded under the workforce development grants. Originally it was for 2022 to 2023. It got extended until 2025 with that workforce funding that is coming from ODH, but as we get closer and closer to 2025, like we're not focusing on slowly looking for funds to further my position. We're mostly focusing on the initiatives and really expanding our collaborations and partnerships. It just seems to fall into that thing where it just happens naturally. People are seeing the efforts that we're doing, the work that we're committing, and they're more willing to support this position if they're seeing kind of those results and partnerships grow. We are looking at maybe having my position and several others who are on that workforce grant. They're slowly merging into our general fund, so it's stuff that's added up over the years. It's not like 5 salaries all at once being hit onto our general fund. But we're also talking in the beginning talks of like the major university next to us about maybe having a part in this position. So having this position split between the university and the health department, because right now it's just the health department, but they're seeing that really good partnerships and the value of having us.
Thank you.
Yeah, wonderful. Thank you. We have a number of hands. Jeff, I will turn it over to you first.
Okay, thanks. A lot of good discussion. We've used a lot of methods to try to improve our relationships. We happen to be a very rural county health department, but we have a technical college that produces nurses, which my wife actually teaches that, which is a great relationship to have if you can finagle that. We also have a campus of the UW system within our county. And recently, one of the faculty just got added to our board of health, which helps firm up some relationships, which is something that I wanted to accomplish because I'm nearing retirement age and we've had such great collaboration with us and the university system here in our county that I didn't want it to fade away once I fade away. So there's that. In addition, I happen to be faculty as well, and I sit on an AHD board, and all those things help build relationships and opportunities to interact. And for us, I'm sure many local health departments coming out of a pandemic and some of the challenges that we faced, currently we have more money than staff. So funding is not a problem, staffing is a problem, and trying to recruit staff through partnerships with universities that are producing some of the very people we want to have work for us has been quite helpful. So I just wanted to comment on some of the strategies that we've kind of done that hadn't been mentioned. And I think really our ability to get a faculty member from the local university on our board and then the relationships we have with our technical college have been super great in allowing us to do a lot of things throughout the pandemic and pre-pandemic with many research opportunities and stuff too. So it's been great.
Awesome. Thank you so much. I know we have more hands raised and we'll get there in just a second. But while we're still talking about some of the challenges, strategies, but Jenna, I saw you put in the chat box that you got a grant in 2020 to kickstart your AHD, and I'm wondering if you might be willing to say a little bit about that. If you can't, that's okay, but
Yeah, I think I can. I will say I was not in my current position, so I do not know nearly as much about it as if I would have been here at the time. So the grant was from Telegen and helped us. It didn't fully support like the workstation and the equipment and things like that for students and interns, but it did help. I don't know the exact amount of match that we put towards it, but we were successfully awarded that, and that allowed us to buy some equipment. But we did put the internship positions in our department budget, which is nice because then now it's there. And so we can kind of keep that up and also make sure that, on the equity side of things, allowing people to have paid internships is important. So, but yeah, it is a lot to manage them too. So from the staff side, like Jeff was saying, that's something that's hard for us as a smaller health department in a rural area. So.
thank you.
Yeah.
Myla, I'll give you back the
Thank you, Jenna. Brian, you want to go next?
Yeah, hi everyone. My name is Brian. I am with the Health, and I had a
Oh,
question
sorry, we
regarding.
can't really hear you if you,
Oh, mm,
You're breaking up a bit, Brian. We can hear you parts of it, but not all of it. So it's you're muted something else.
how does this sound?
Better.
that's
Better.
better.
Okay. Okay, perfect. Sorry about that. Hi everyone. My name is Brian. I'm with the Madrid County Department of Public Health, and I had a question regarding kind of the title of academic health department. Us being a smaller and recently accredited health department, we're kind of also looking to expand our efforts into sort of establishing our affiliate agreements, cooperative agreements with our local universities and whatnot. And we do have quite a bit, but one question that came to mind is kind of what is Public Health Foundation's recommendations as to health departments kind of titling themselves as academic health departments. So for whatever reason, like, is there a similar process to like accreditation where you can have to demonstrate documentation to show these relationships based on this model, or is it kind of just like, hey, if you feel that you have everything you can adequately demonstrate that based on the model, and you're kind of like free, there's free reign to use that title, or kind of what is your team's recommendations for that approach?
Yeah. More of the latter, Brian. There isn't really any set of criteria. If excuse me, if a health department demonstrates them that they're then an academic health department, so far at least, we pretty much left that determination up to you, whether you're really an academic health department or not. There is some talk now as this concept is beginning to take off a bit now. There are more and more places around the country that are exploring this seriously and doing interesting things. There is some talk about trying to get some sort of academic health department organization going. Maybe that can happen this year, possibly even at the APHA meeting in the end of October. Not sure, but that might at least provide some central place to provide recognition, or maybe just registration. I mean, there's no place that catalogs the academic health departments. At the learning community and the Council on Linkages, we sort of list those we're aware of, but we don't go out and ask every health department if they're an academic health department. Although we know, as Kathleen mentioned, most health departments do have some sort of academic connection. I mean, the large majority. So it's evolving. When we started the learning community 12 years ago now, almost 13 actually, we developed a definition, and we've called it a working definition. It's a draft, and we've had it for 13 years because we have never really been in the position where we thought we could completely define this universe of so many different organizational structures. So it's up to you. What's of most interest to us at this point is to help people make these connections, because we think we have a growing body of evidence that it makes a difference, that public health services are delivered better. We know that at least one study showed that academic health departments self-identified as members of the learning community early on were twice as likely as health departments not linked to an academic institution to deliver public health services that were evidence-based. That's an important issue for us. So, we don't know yet about public health outcomes necessarily, but we have a lot of process and experience now to show that these relationships seem to bring good things. And actually, we're hoping some of you can get involved in doing some of the research that's necessary to better understand just what is happening, what works, what doesn't, what kind of public health impact do these have? Are communities more healthy because of them? Questions like that. hard ones to answer, but we hope eventually as the literature builds, and by the way, we encourage all of you who are involved in this to write about your experiences, get stuff into the literature so we have a better sense of what's going on in the country. But yes, so none of us are card-carrying members of the Academic Health Department Club.
It's true. So as Bill mentioned the definition, we laid out a number of characteristics in that definition, kind of like we just did in the slides here. But yeah, then it's up to you to decide whether you feel like that fits your organization, your partnership. I will say, just to tie it to accreditation, the current version of the accreditation standards for health departments allow you to use your academic health department partnership agreements as documentation for some areas in related to workforce, and I think also related to like the use of research and things like that. But there are no, as Bill said, there are no hard and fast, you must do this, you must do that. We do, as Bill mentioned, have a list on our website of partnerships that have self-identified. So if any of you all, and Myla, maybe you can drop that link in the chat if you haven't, but if anyone is working in an AHD partnership environment and you're not on that list, feel free to let us know, and we'll add you to it. But yeah, it's pretty loose. I feel a little silly sometimes when I send out people ask, and we share the working definition with them, last updated in like January 2011 or something, and I always wonder what people must think about the fact that it's a working draft, but it's really, there's just so much variety and so many different ways that people have accomplished this. It never felt I don't know, it never felt right to kind of put a limit and say you must look exactly like this.
I did just put in the chat box a reference. Someone asked for a reference. Talking about the reference I put in the chat box is not the original research. That's Paul Irwin, done I think 2016, 2017, something like that. And I think you can find the reference on our website.
Yeah, let me look. I can look real quick.
One thing you won't find on our website, at least I don't think it's there, is the American Review of Public Health, last year again by Paul Irwin. It's a very nice article. It's a review article summarizing a lot of information about academic health departments, what they are, what their impact is. It's relatively new, but it's very worth the read of it is very worthwhile.
Oh, great, thank you. Lauren, you have had your hand up for quite some time. I want to turn it over to you.
Hi, thank you. Can you hear me okay?
Mm-hmm.
Yes.
Yes.
Awesome. So I am coming from the academic institution side. I work for the University of Michigan within the public health practice office with the School of Public Health. And we have a partnership with the Washtenaw County Health Department. And the partnership's been established. We're still kind of figuring out bigger picture things. And I did put these questions in the chat, but I'm just curious to know more if there's anybody who can speak to this on the call about what their structures of their academic health departments look like, the types of activities and experiential learning that are being done. I know Katie shared her email address with me and Ron shared a link of past webinars, but which I appreciate, and I'll definitely look into those, but just curious if anyone else can speak to that. And then we've also had conversations around, since we just got our MOU in place a few months ago, we're discussing how to launch, promote, or publicize this formal agreement and partnership, either maybe with like some type of kickoff, or I don't know, I'm just curious to know ideas around this concept, how to kind of hit all those areas with like the health department side, the academic institution side, with publicizing that.
Awesome. We can give you some, or I can give you some general ideas, but I would love to hear if there are people on the webinar here who'd like to share a little bit about their structure or how you've coordinated things, what kinds of activities you're doing, or things that have been really successful, how you've let people know that you're doing them.
Mhm.
Does anyone want to share?
I can talk about some of the things that I do.
Awesome, thanks, Sarah.
I've been in this position for 2 years. I'm the first one to really hold it, so I've really gotten to build this from the ground up. Some of the things, most things I get looped into everything, like whether it's involving students or like presentations, especially at schools. We really have created a good procedure for all of the staff to have one contact person here and one contact person at the health or like at the other universities. Some of the things that work very well for us are presentations. So going out to classrooms, doing presentations on the programs that we have here. Even though we have such a large community in Lucas County, not a lot of people know about us. So starting out with that promoting and letting people know about the resources we have here, and letting them know. One of the biggest things that kind of really helped our department take off is connecting with those nursing students. They're always looking for clinical sites to rotate around. There is no shortage of nursing students, and they're always looking for those resources and referral places to have. So those are some of my best friends that I have in this health department, is working with them to educate their students on the services we provide here, and in turn getting them a place for them to rotate with our nurses. Some of the other things I do that don't deal directly like with students coming in, I also deal with learning internally for our staff. So we do programs to help them get classes that they might need for professional development. We've gotten funds from this program through Ohio called Tech Cred, so they can take classes in Excel, Word, ArcGIS. We also have stuff for tuition reimbursement funneling through me. We have funds from the Association of Ohio Health Commissioners. We have employees who have taken certifications, undergrad, grad, doctorate. We're able to get up to $10,000 back to them directly. And then most recently, we had a few staff really interested in getting certified in infectious disease certification. And we saw this thing through the NACHO. So we actually applied to that, and we actually just got it. So we'll get a few certifications for our staff to do those. Those are stuff that keep the staff very happy here that they're able to have that. And it's really helped with retention. When I first started, we had people just constantly in and out. But since we've started also allowing our staff to participate in the learning, everybody has gotten a little bit happier, and we're more willing to take on like having interns in their department, getting projects done, that sort of thing. So it's really that nice balance that has really been most successful for us.
And I saw, Stephen, you came off mute at one point. I didn't know if that was because you had something to say or just an accident.
No, I was trying to figure out how to raise my hand. Hi, Steve Hooker. I'm Dean of the College of Health and Human Services at San Diego State University. About a year and 3 months ago now, when we kicked it off, we had a major press event. The president of the university, the director of the Health and Human Services Agency for the county, a county member of the County Board of Supervisors, and I myself all said a few words. We signed the MOU together. We had about 100 people there who then we had a working lunch, broke out into topics, brainstormed about what this partnership could focus on over time. So even if you've been working a while, if you haven't had something like that, it might be interesting to maybe like on an anniversary, have some kind of a press event or where the media can show up, or you can get a little bit of pub that way and re-energize, if you will, and get a lot of people in the same room at the same time because their bosses are there, and so they're likely to show up, whether it's faculty or from the county side. So anyway, it was a great way to start, and also it sort of opened up our eyes that there's a lot of people looking at how this is going to play out. So you feel the need to make it work, put in the time and effort that is beyond your typical job sometimes, to really help this all come together over time.
That's a great idea. When we first started working in this area, I remember searching, one of the ways we tried to figure out who was doing this work or where some AHD partnerships were, was looking for news articles. And we'd find articles that are like announcing a partnership, and they've got photos with all the, the health director and the dean and things like that. I wouldn't say I found a lot of them, but it was always fun to find them. I had two other random thoughts that I think that people I've heard about that have been really fun in terms of promo, but also just building that working relationship. So one is the idea of having some kind of symposium or just a day where people can get together and share what they're working on together. So I think that's been really nice as organizations have started to work on projects. They then, can invite people in from the organization to hear a little bit about the collaborative work that's going on and the successes and things like that. The other one that I always I find really fun there was a group, I think it was in North Carolina maybe, but they did like a speed dating basically, where they brought in anyone, from the two institutions was welcome to participate, and they had like 5 minutes to talk to someone from the other institution to see if you had any areas of interest in common or things like that, and then you rotate. So I thought that was a really fun way to, they were just trying to get people introduced to each other and get the word out about what they were doing. So that's one I always think is really fun.
Yeah, there's a formal thing we did that was helpful. The medical school that I worked with, of course, had a list of teaching hospitals, and they were considered part of the medical school consortium. We were able to convince the medical school to do the same for teaching health departments or academic health departments. So those health departments then began to appear on the stationery of the medical school and on the website as associated institutions. So it gave them a little bit of clout in the community and helped introduce the medical practice community, at least, to the reality that there really are health departments, and that even medical students, as well as other health profession students, need to learn something about public health.
Great, wonderful. Thank you so much for this amazing discussion, for sharing your experiences. I think it's been really lovely. We unfortunately are at time. Bill and Kathleen, any final words to leave us with before I go back to sharing screen over here?
If there's a lot of interest, I guess we could do this again.
Yeah.
You can do this all the time. No, it is fun. And it's yeah, so exciting, interesting to hear what's going on.
For us, I hope it might be useful for the people on.
I hope it's useful for you. I would just encourage everyone to keep in touch if there are other questions. I have not been able to read the chat box, but I can see that there's a zillion messages in there. So definitely feel free if we didn't get to your question or things like that. Reach out. We're happy to help. We're happy to help make connections, and the learning community is a great resource for all of that. You can post questions on the listserv, things like that. So I will let Myella share the closing slides.
Great. So as we close, just wanted to leave you with a handful of resources that might be useful as you're exploring your AHD partnerships. You can find the Academic Health Department Learning Community online, as well as the archives of our AHD webinar series. This webinar will be posted before the end of the week, so keep an eye out for that, as well as other resources and tools related to AHD partnerships. For anyone who signed up for the learning community in registering for this webinar, you will be added to the group in the next couple of days. But please let me know if you did not check that box as part of the registration. Feel free to send me an email. I'm happy to add you. In addition, we want you all to be aware that we put out an approximately monthly newsletter, the Council of Linkages update. that regularly features the latest about AHD partnerships. So if you're not subscribed to that, you can do so by clicking on the link in this slide. The slides were shared at the beginning of the meeting, but I'm happy to send it again before we close here in a moment. And please feel free to, explore the resources we have and let us know if there are any questions or if we can help you find anything. So thank you all so much for joining us. It was really lovely, and I will go ahead and drop the link to the slides in the chat again. So thank you all so much.